Do you think, can face masks prevent coronavirus? To know what experts say about this, stay tuned. If you new here, don't forget to subscribe our channel and press the bell icon to get next video. A new coronavirus outbreak, which originated in the Chinese city of Wuhan and has spread throughout Asia and globally, has prompted people around the world to buy medical face masks in hopes of preventing infection. Retailers in the US and across the internet are running out of antiviral face masks as the number of confirmed cases of the coronavirus now exceeds 9,700 globally. More than 200 people have died from the virus in China, where the majority of the 2019 nCoV cases have been detected. The World Health Organization declared a global health emergency on Thursday as the outbreak continues to spread. As of Friday morning, the United Kingdom and Russia had both confirmed their first cases of the viral infection. Local government officials in Wuhan have required that people wear face masks when they go out in public places to prevent the spread of infection. Health experts tell that such a move is probably effective in the city, where a person is more likely to come in contact with someone who is infected than in other parts of the world. But in the US, where just 6 cases of the coronavirus have so far been detected, wearing face masks will not be that effective, experts say. That's largely because, according to public health workers, there is no sustained person-to-person transmission of the new coronavirus in the US, making face masks not yet necessary. People believe wearing masks will protect them against a novel organism they're scared about, says Saskia Popescu, a senior infection prevention epidemiologist at a private healthcare system in Phoenix, Arizona. I understand the fear, but the US is at a very low risk for this right now. What does the CDC say about using face masks? The Centers for Disease Control and Prevention does not currently recommend that people in the US wear face masks in public to prevent infection. Dr. Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases, told reporters during a press call on Thursday that the best preventative measures include washing hands and covering coughs. The CDC has issued guidelines on 2 different kinds of face masks, surgical masks and N95 respirators, which are commonly worn by healthcare professionals and those who are already sick. Typical surgical masks usually found at pharmacies, and which were sold out on Amazon and other e-tailers as of Friday, are approved by the U.S. Food and Drug Administration to protect the wearer against large droplets or splashes of bodily and infected fluids from others, according to the CDC. Wearing surgical masks does not prevent a person from inhaling smaller airborne particles. They are not considered respiratory protection by the CDC. Surgical masks are also loose-fitting, and when the wearer inhales, there is potential for particles to leak in or out of the sides. N95 respirators are recommended for healthcare professionals by the CDC in the event they are treating patients who are infected by the new coronavirus. The N95 masks, which require testing and approval by the CDC, are tight-fitting and filter out at least 95% of airborne particles. Follow description box link to buy N95 mask. Can face masks prevent diseases? Studies on the efficacy of face masks in preventing diseases are inconclusive, largely because they have only been conducted on healthcare professionals in their workplace settings. In general, studies have found that if workers use face masks, the risk of spreading disease as they deal with infected patients is reduced, according to experts. For members of the public, the effects of using face masks are not well known. But experts say already sick and infected people who can't avoid going outside, especially those who will be in confined spaces or hospital waiting rooms, should wear masks to avoid spreading germs. What are more effective preventative measures to avoid coronavirus? Advice from the CDC and health experts on better preventative measures against viruses like the novel coronavirus or influenza is fairly straightforward and involves basic everyday actions. To help stop the spread of respiratory infections, it is recommended that people wash their hands often, avoid touching their faces, keep distance from people who are sick and to stay inside if they are sick.